Early warning signs of neurological deterioration are critical for nurses to recognize because timely intervention can prevent permanent damage and improve patient outcomes. Neurological deterioration can develop rapidly or gradually, and the signs may be subtle at first. Understanding these early indicators is essential for effective monitoring and care. Neurological deterioration refers to a decline in the function of the nervous system, which includes the brain, spinal cord, and peripheral nerves. This decline can result from a variety of causes, including stroke, traumatic brain injury, seizures, hypoglycemia, infections, tumors, toxins, and metabolic disturbances. Early detection of changes is vital because interventions are more likely to be successful when started promptly. One of the most important tools for assessing neurological status is the Glasgow Coma Scale. A decrease of 2 or more points on the Glasgow Coma Scale is a strong warning sign of neurological deterioration. This scale measures a patient's level of consciousness, and a score below 8 is considered a medical emergency, indicating severe neurological compromise that requires immediate intervention. Changes in level of consciousness are among the earliest and most significant signs of neurological decline. Patients may progress from being fully alert and oriented to being drowsy, confused, or unresponsive. Sudden drowsiness, difficulty waking the patient, or complete unresponsiveness should always be treated as a medical emergency. Headaches are a common neurological symptom, but persistent, severe, or sudden onset headaches that are different from usual patterns should raise concern. These headaches may indicate increased intracranial pressure, bleeding, or other serious conditions. Vision changes are another early warning sign. Blurred vision, double vision, sudden loss of vision, or visual field deficits can signal neurological deterioration. These changes may result from stroke, increased intracranial pressure, or lesions affecting the visual pathways. Muscle weakness or loss of strength, especially if it occurs suddenly or affects one side of the body, is a red flag for neurological problems. Weakness may involve the face, arms, or legs and can be accompanied by drooping of the face or difficulty speaking. These signs are classic indicators of stroke and require urgent evaluation. Numbness or tingling in the limbs, face, or other parts of the body can also signal neurological deterioration. These abnormal sensations may be caused by nerve damage, compression, or impaired blood flow to the brain or spinal cord. Loss of coordination and balance is a key warning sign. Patients may have difficulty walking, stumble frequently, or be unable to maintain their balance. These symptoms can indicate problems in the cerebellum or vestibular system, and may be associated with stroke, tumors, or other neurological disorders. Speech and language difficulties are important indicators. Slurred speech, difficulty finding words, trouble understanding language, or sudden inability to speak should be taken seriously. These symptoms may result from damage to the language centers in the brain. Seizures can be a sign of acute neurological deterioration. A seizure may present as convulsions, sudden loss of consciousness, muscle rigidity, or unusual movements. After a seizure, patients may be confused or have difficulty regaining consciousness. Changes in sensation, such as loss of feeling, abnormal sensations, or pain, may indicate nerve or spinal cord involvement. These changes can affect the ability to perceive touch, temperature, or pain. Memory loss, confusion, and impaired mental ability are early cognitive signs of neurological decline. Patients may become disoriented, forget recent events, or have trouble concentrating. These symptoms may be subtle at first but can progress rapidly. Mood changes and emotional instability are also early warning signs. Patients may experience sudden mood swings, emotional outbursts, or apathy. These changes can be caused by alterations in brain function and may be seen in conditions like dementia, or after brain injury. Sleep disturbances, such as insomnia or excessive sleepiness, can occur with neurological disorders. Patients may have difficulty falling asleep, staying asleep, or may be excessively drowsy during the day. Other physical symptoms to watch for include tremors, muscle rigidity, back pain that radiates to the limbs, and loss of bladder or bowel control. These symptoms may indicate spinal cord involvement or progressive neurological disease. In some cases, patients may develop new or worsening headaches, neck stiffness, or photophobia, which could indicate meningitis or increased intracranial pressure. Persistent dizziness or vertigo that does not resolve with rest is another warning sign. While occasional dizziness can have benign causes, chronic or sudden onset dizziness may indicate a serious neurological problem. Any sudden or unexplained change in a patient's neurological status should be considered a potential emergency. This includes new onset of confusion, agitation, loss of consciousness, or inability to move or speak. It is important for nurses to perform regular and thorough neurological assessments, including checking level of consciousness, pupil size and reactivity, limb strength, sensation, speech, and coordination. Any changes from baseline should be documented and reported immediately. In summary, early warning signs of neurological deterioration include changes in consciousness, severe or unusual headaches, vision changes, muscle weakness or numbness, loss of coordination, speech and language difficulties, seizures, memory loss, mood changes, sleep disturbances, and abnormal sensations. Recognizing these signs promptly and seeking medical evaluation can make a significant difference in patient outcomes. Nurses play a crucial role in early detection, ongoing monitoring, and rapid intervention when neurological deterioration is suspected.